Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, this is Tom Viola with yet another Fast Facts Pharmacology Edition. Well, we're still in our discussion of respiratory drugs, and now we're going to talk about inhaled corticosteroids. Remember that inhaled corticosteroids are just that, they're steroids. So they reduce hypersensitivity of the airway to allergens, but they also reduce inflammation. And therefore they decrease the narrowing of the airways that sometimes takes place, as well as decreasing the swelling at the bronchioles. Well, what kind of drugs are inhaled corticosteroids? Well, you probably know them: Qvar, beclomethasone, Flovent, fluticasone, and even Pulmicort, budesonide. Well, what are they used to treat? Inhaled corticosteroids are used to treat chronic asthma and COPD. This is a theme, if you haven't noticed it already, in these few episodes about respiratory pharmacology. The same drugs can be used to treat both asthma and COPD. Okay, well, we love inhaled drugs whenever possible. Why? We're using lower doses and therefore getting less adverse effects. Well, how can we use lower doses? Well, that's because we're delivering the drug directly to the bronchioles. But can they still cause xerostomia, cough, and even hoarse voice? Absolutely. All right, so why do we care so much about corticosteroids? Well, you know that steroids reduce inflammation. And anytime we reduce inflammation in our physiology, we reduce immunity. And that increases the risk of opportunistic infection. Well, in the case of the oral cavity, that would be what? Both oral candidiasis and fungal pharyngitis. Now, our usual advice to our patient when they've got inhaled corticosteroids on board is to rinse after they use the medication. That is of some help, but realize these medications are fat soluble. That's how they work. And so rinsing with water may not remove the medication versus brushing and flossing. Although, how many people do you know brush and floss after they use their inhaler? You get the idea. Also, we recognize that if you're going to use an inhaled corticosteroid, along with a beta-2 agonist, that the beta-2 agonist is almost always used first. That way, you get bronchodilation and opening of the airway so that the other medication, the corticosteroid, could penetrate even deeper. All right, don't forget that these drugs are often used in combination. So sometimes Advair is used, we're using a steroid, fluticasone, with a long-acting beta-2 agonist called salmeterol. 2 drugs for the price of 1. Same thing with Symbicort, which is budesonide, and formoterol. Same thing, 2 drugs for the price of 1. Very popular with your patients because it's 2 drugs for 1 copay, but it's also convenient and encourages compliance because they're getting the 2 drugs at once. Finally, the drug Singulair is also used to treat asthma, but not COPD. However, it is also used to treat allergies. Singulair is a leukotriene receptor antagonist. It blocks the effect of leukotrienes and therefore inhibits the immune response of the airway to allergens. So it decreases airway constriction, decreases mucus secretion, and promotes bronchodilation, which is wonderful. But remember, it's really only used for asthma and allergies and definitely not COPD. While Singulair has its adverse effects, such as headache and maybe even nausea and diarrhea, remember, blocking inflammation means blocking immunity and an increased risk of infection. Plus, one little known fact about Singulair is that it increases thoughts of suicide. And so for patients, younger children, older children, young adults, this can be problematic. So as I've often said to my hygienists in both my lectures and in my classes, be the bartender. A good bartender knows when to listen and when to speak. So listen, because you're approachable, and a patient who has suicidal thoughts may tell you things they won't tell anybody else. Listen and then speak. Give them the information they need for their suicide prevention hotline. Give them encouraging words and thoughts so that they can persevere when these medications influence their brain chemistry in that way. All right, my friends, we're off again on another episode coming up soon on the treatment of asthma and COPD. But until then, my friends, stay tuned. This is Tom Viola with yet another Fast Facts Pharmacology Edition. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.